In the studio now for this week's Your Health segment, Dwight Holmes, Director of Psychiatric Services at the University of Maryland's Baltimore Washington Medical Center, and Kurt Haspert, Addiction Medicine Nurse Practitioner at the University of Maryland, Baltimore Washington Medical Center. Gentlemen, thanks to both of you for being with us.
Thank you.
We talk about mental illness. The numbers are remarkable. 18% of the adult population, and still it may be underdiagnosed.
There is a hesitance sometimes for folks to want to seek treatment. There are still issues about stigma that are a concern. And I guess one of the things that I want to be able to say is that this is a health problem. It's not a moral problem. It's not a question of whether you've been right or wrong. The brain is part of the body. All parts of the body suffer disease, illness, and the brain's no exception. So, talking to your provider, talking to the doctor, getting some help is the best way to getting back on track with your health.
And the other point is that, like other conditions, these conditions are treatable. You can help people.
You sure can. I think the most important thing is accurate screening. That's usually done in a primary care office. And recognition from family members when they see someone who may have, not completing tasks that they used to be able to complete easily, not participating in activities that you used to find fun, loss of sleep, loss of appetite, things like that, to prompt someone to come in and be screened and be treated.
When somebody gets to that point and is potentially handed a diagnosis, how is that greeted? Is that something that they fear? They don't want that diagnosis, or is it something that gives them a sense of relief that they know what the problem is?
Well, I think most of what doctors tell us, other than when you've got a clean bill of health, is something that you don't really want to hear about. You don't want to hear about the high blood pressure or the diabetes or the high cholesterol and stuff. So this is another issue that you may not want to hear it, but you're better off to know what it is so that you can develop a treatment plan and decide, okay, which way do I want to go? Because the treatment plan for a mood disorder is going to be somewhat different than whether or not someone's suffering a thought disorder. So when I say thought disorder, I'm talking about someone who may have like a schizophrenia or other psychotic disorders. Oftentimes patients who are experiencing that are quite wrapped up in what they're thinking. And it's, as Kurt said, it's the people around you who are saying, hey, there's something up and needs to be attended to. Most mood disorders, particularly the depressions, is something that we tend to recognize and notice that something's not right, we don't feel good, we want to get better. So it's an important piece to hear from your family and the people that you care about, as well as recognizing that for yourself and asking for the help.
Let me remind our viewers, if you have a question about mental health treatment and fighting the stigma of mental health disease, give us a call. We'll have the number up on the screen. The diagnosis of it is a little different than some other conditions in that there's no blood test.
Correct.
It's not necessarily black and white.
So typically with there's a series of questions that are going to be asked, and those are more probing questions with regard to what Kurt was saying in terms of, are you noticing your energy dropping? Are you having difficulty with your sleep? In some instances, sleep may drop, where you have less sleep, and where it may increase, changes in your appetite. What have you been noticing about your mood? Loss of interest, isolating from people. Trouble concentrating, those kinds of things, and those are where the questions are at. And then there's questions that are going to be asked about whether or not you have thoughts of suicide, whether you've been thinking about whether or not you just would be better off dead, or are you putting together some ideas about how you might do it, where you would do it, when you would do it, contingency plans, making sure that you're found versus not being found. Questions that are geared towards that kind of an assessment helps the investigator to better understand the severity of the illness and what course of treatment to take.
Let's grab a phone call. Arundel County, this is David. David, thanks for the call. Go ahead.
Hi, this is David, and I'm calling about, we're recognizing these things with mental health problems, but I live in Anne Arundel County, for instance, and I've had some acquaintances and even relatives that have had problems with mental health issues, and the immediate care and even the short-term care is terrible as far as treating it. I mean, like a physical disease, a mental disease is also a condition. Usually they, like Anne Arundel County, they'll take you to Anne Arundel Medical Center. You'll be held there until they ship you off to somewhere like Shepherd Pratt or maybe somewhere Shady Grove in Montgomery County. There's really a lack of any facilities to address the immediate problems.
David, thank you very much for the phone call. Let me get an answer to the question about access to care.
I think access to care is one of the biggest issues that we have, not only in Maryland, but in the United States. Unfortunately, in this part of the world, in central Maryland, we have fewer psychiatric beds than some other industrialized countries have. The recent community needs assessment that was done by the Healthy Anne Arundel Coalition said that there's about 700 patients to one psychiatrist in Anne Arundel County and about 500 to one in the state of Maryland, and that's not a good thing. When you have someone that's in crisis, we can do stabilization, but this is a chronic disease that needs treatment, not just in a short-term phase, but in the long-term phase also.
Given the resources, given the community concern and somebody's individual situation, what can you do to help them? What do you recommend in terms of getting them into a good situation?
Well, the best thing is to first make your needs known, whether it's starting with your family or talking to your primary care doctor and asking the questions and making inquiry. Make yourself available to get the help is first and foremost. A number of conditions that we face as human beings, dealing with stress, dealing with problems, and those problems can sometimes become crisis, is asking for it, and sometimes talk therapy is sufficient. Being able to just kind of have somebody who listens and who may give you suggestions about things you can do to kind of change the way you think, so that you change the way you feel, so that you make a change in your behavior and how you handle things. In other instances, the talk therapy is combined with medication. And the combination of the two helps to stabilize the crisis and get you to the point where you can do the talk therapy for the problem. So just doing the medications can be helpful for some patients, and maybe the more severe conditions, that's a primary thing, because you got to get the biology of the brain to settle down so that you can get the psychological part discussed in talk therapy.
Very good. Dwight Holmes and Kurt Haspert, the University of Maryland, Baltimore, Washington Medical Center. Gentlemen, we appreciate the time.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.